In 1880, every American physician carried a plant in their medical bag that killed the same bacteria as modern antibiotics. It required no prescription, no laboratory, no patent. It grew for free in every yard in America. In 1905, it was quietly removed from the United States Pharmacopoeia, the official list of approved medicines, replaced by compounds that could be manufactured, patented, and sold. Today, that same plant is growing through the cracks in your driveway, and the newest peer-reviewed science has just confirmed what your great-grandmother knew. This weed outperforms pharmaceutical antibiotics against drug-resistant superbugs. Welcome to USA Grows. The archive opens in the forests of Europe and Asia, where broadleafed plantain, Plantago major, has been used as medicine for over 2,000 years. The ancient Greeks called it arnoglyssa, lamb's tongue, for the shape of its leaves. The Anglo-Saxons included it in their 9 herbs charm, a 10th century invocation for healing. But the name that stuck came from the colonists. Native Americans observed that wherever European settlers disrupted the earth, plantain immediately colonized the path. Its seeds become sticky when wet, clinging to boots and hooves. They called it the white man's footprint, not because they feared it, because they recognized it as a sign that a powerful medicine had arrived. Now let us talk about what modern science has discovered inside that unassuming leaf, because this is where the suppression becomes criminal. Plantain contains aucubin and bicolain, potent iridoid glycosides. Peer-reviewed studies confirm that these compounds exhibit direct antimicrobial and antibiofilm activity against Staphylococcus aureus, including drug-resistant MRSA strains. The same bacteria that kill tens of thousands of Americans every year because antibiotics no longer work. A weed in your yard kills it. But it gets more specific. Breakthrough pharmacological screenings have identified a compound called plantamosidase, or PMS. This active ingredient significantly inhibits sortase A, an enzyme that multi-drug-resistant bacteria use to anchor virulence factors to their cell walls. Without sortase A, the bacteria cannot attach, cannot infect, cannot kill. Plantain does not just poison bacteria, it disarms them. Here is what they did not tell you. Plantain is also rich in allantoin, a compound that stimulates rapid cell proliferation and tissue remodeling. The cosmetic industry isolates allantoin and sells it as a star ingredient in luxury skincare. They charge $50 for a jar of cream containing what grows free in your lawn. But the real medical application is even more powerful. Clinical trials have demonstrated that a simple 10% topical formulation of plantain leaf extract significantly accelerates the closure of stubborn diabetic foot ulcers and deep pressure wounds. Wounds that would not heal for months closed in weeks, not because of a patented drug, because of a weed. The nutritional counter-narrative is equally striking. Ounce for ounce, fresh plantain leaves contain a higher concentration of vitamin C than commercial oranges. They're also packed with vitamin K and beta-carotene. This is not a weed, it's a multivitamin growing in your yard. And it kills gram-negative pathogens, too. A landmark 2015 pharmacological evaluation verified that crude extracts of plantain significantly inhibit the growth and cellular replication of E. coli and Salmonella, the foodborne bacteria that send tens of thousands of Americans to the hospital every year. Now, let us talk about the modern biomaterials research, because this is the part that should make you angry. Scientists have successfully encapsulated Plantago major extract into nanostructured electrospun polymer mats. The weed's natural polysaccharides trigger a swelling capacity of over 400%, actively pulling toxic exudate away from infected skin tissue. That means a wound dressing made from plantain is better at cleaning infected wounds than synthetic alternatives, and the plant grows for free. The polymer mats cost millions to develop.
Mullein, Verbascum thapsus, is the second plant on your forbidden list. Long before the discovery of modern pharmaceutical antibiotics, 19th-century physicians routinely used mullein to treat tuberculosis, severe whooping cough, and chronic respiratory congestion. The leaves are dense with verbascicide and saponins, compounds clinically proven to possess powerful anti-inflammatory, antiviral, and anti-adherent properties. They reduce the ability of oral and respiratory streptococci to stick to mucosal surfaces. That means mullein doesn't just kill bacteria, it prevents them from colonizing your throat, your lungs, and your sinuses. The historical uses of mullein are as strange as they are effective. Roman soldiers dipped the long, dried flower stalks into tallow to create long-burning tactical torches. Quaker women rubbed the furry leaves on their cheeks to trigger a natural blush via localized circulation. But the medicine is the real story. Infusions of mullein flowers in an olive oil base contain high levels of plant lipids that act as local analgesics. Traditionally used to soothe deep earaches and neutralize bacterial ear infections without damaging the tympanic membrane. A mullein oil dropper costs pennies to make. An antibiotic prescription for otitis media costs $50 and contributes to resistance. Now, let me tell you about the Civil War field records. When Union blockades cut off Confederate field medics from imported medicines, documented military medical logs revealed that surgeons successfully substituted lost supplies with wild-harvested plantain and mullein to prevent gangrene and sepsis. They used what grew around them, and it worked. The official record of the war includes hundreds of cases where herbal poultices saved limbs that would otherwise have been amputated. So here's the question nobody in the pharmaceutical industry wants to answer. If plantain and mullein are this effective, why were they removed from official medicine? The answer is simple, brutal, and reveals everything. Plantain was listed as an official medicine in the 1880s United States Pharmacopoeia, but by 1905 it had been systematically removed. The medical establishment was shifting towards patentable petroleum-derived chemical isolates. You can't patent a weed. You can't charge recurring revenue for a plant that grows in every yard. The same year plantain was purged, the pharmaceutical industry was consolidating its control over the American medical system. Then came 1962. The Kefauver-Harris Drug Efficacy Amendment demanded millions of dollars in synthetic-focused clinical trial data for any drug to remain on the market. Traditional, unpatentable botanical medicines were effectively decoupled from official medical standards. The same year pharmaceutical antibiotics became the industry standard. Coincidence? The record says otherwise. Here is what they did not tell you. The bacteria that modern antibiotics cannot kill are growing more resistant every year. MRSA alone kills over 10,000 Americans annually. The pipeline for new antibiotics is nearly dry. Pharmaceutical companies have little incentive to develop drugs that patients take for a week and then stop. Chronic medications are profitable. Acute antibiotics are not. Meanwhile, plantain has been killing MRSA in petri dishes for decades. The research is peer-reviewed, the compounds are identified, the mechanism is understood. But no pharmaceutical company will invest in clinical trials for a weed. You can't recoup a billion-dollar investment on a plant that grows in sidewalk cracks. The global resilience of plantain is the final insult to the profit model. It grows effortlessly across virtually every climate zone where humans live. It's completely uneradicatable, a permanent biological resource. You can't kill it with herbicides without poisoning your soil. You can't pull it without it regrowing from root fragments. The plant that heals you refuses to die. That's not a bug, it's a feature. So what do with this knowledge? You walk outside, you look at your lawn, you find the broad, oval leaves with parallel veins, plantain. You find the tall, woolly stalk with yellow flowers, mullein. You pick a leaf, you chew it, you apply it to a cut. You watch it stop bleeding. You watch it prevent infection. You watch it heal. And then you ask yourself why no one ever told you that the most effective medicine for the most dangerous bacteria was growing under your feet the whole time. If this story opened something for you, subscribe to USA Grows and hit the bell. Every like and every share helps preserve this wisdom. The next story opens soon.